Hi, welcome to today's podcast. I am Femi, your host for the day, and today we are having Dr. Vijaykumar, ankle, foot, and sports surgeon with an impressive experience of 16 years from AIMS, Delhi. And currently, Dr. Vijaykumar is working at SPARSH Hospital, Infantry Road. As a leading expert, Doctor, let's uncover the myths about ankle sprain. So, Doctor, may I know what is ankle sprain and how it happens?
Femi, the ankle sprain is because of the ligament tear that is there in the ankle. So
Okay.
when we start any activities like running, marathon, trekking, yoga, or any sports, most of us, the individual who starts, they will not have a strong balance or strong balancing power in the ankle. So that the reason when they start activities like the jumping, when they land on the ground, running, or when they are running in the uneven surfaces with the very bad shoes, that is when the ankle get twists.
Okay.
When the ankle get twist, there is a ligament called anterior talofibular ligament, or in the short form it is a ATFL, that gets stretched if it is a minor injury, or it gets a tear, partial tear if the forces are more, or it tears completely if the forces are further more. So that is what is called as ankle sprain.
So, how do we identify an ankle sprain?
Femi, as I told, the ankle sprain that occurs on the outer aspect of the ankle where the ligament gets stretched. And if it injures, there is a small blood vessels which are there in the ligament, it gets torn apart. And because of which there will be swelling and there is a pain. A person is not able to stand and walk with a full weight bearing.
Okay.
So, swelling pain at the ankle area is a sign that your ankle ligament might have torn. That is when you need to visit or see a ankle foot expert.
How do we differentiate from the first ankle sprain to the multiple ankle sprain?
Yeah, that's a very good question, Femi. The first ankle sprain, when it happens, it's mainly they'll have a pain and swelling. If you don't treat rightly, aptly by an expert in the field of ankle foot, then there'll be a chance of mismanagement where ligament will not heal in an optimum way or in a right way. That's when the ligament is not functioning properly, and those people, they tend to have a frequent ankle sprain. They're coming up with ankle sprain every month or once in 2 months and 3 months. Those are called multiple episodes of ankle sprain. So first ankle sprain is completely different from multiple ankle sprain, because first ankle sprain, most of the time, if you treated by a expertise in the field of ankle foot, they will treat very with a judiciously and with a lot of insights into the ankle ligaments. So there is a high chances that you will be cured completely without surgery at the first episode. If it is mismanaged, if it is not treated adequately, or with a adequate knowledge by an adequate knowledge person, so there might be a chances that your ligaments are not working properly and you end up having a multiple ankle sprains, which may be dangerous for your ankle because it may lead to a fracture, it may lead to other ligament tears. So that is a disaster.
Okay. Doctor, when do we go for a treatment? Like, what are the treatment options available for this ankle sprain?
Ankle sprain, as you asked in a previous question about the first ankle sprain, most of the first ankle sprain, they may not need surgery if it is treated by an expert.
Okay.
But if they have a frequent ankle sprain, like they say that doctor, I had an ankle sprain last month, but again I have a pain sometimes, but I'm getting ankle twist again and again. I'm not confident to walk on the uneven surfaces. I'm not confident to run.
Okay.
I'm not confident to do some sports activities. I have apprehension, or I have a fear that ankle might get twist. So these are the indication that their ligament, or they have not taken a good treatment at the first time when their ankle got twisted. So now the ligament is not functioning properly. So this is the time when most of these patients they need surgery, unlike the first ankle sprain where most of them can be treated without surgery.
Okay. And when it comes to surgery, what they do in the surgery? How long will it take to cure or heal completely?
Yeah, this is what most of the patients, when I say to them that you need surgery, this is what the most of the patients they think, when soon I can go back to my office, when how soon I can go back to my day-to-day activities or office work or sports.
Yeah.
So before surgery, what we do is to advise a MRI to those patients.
Okay.
Because most of these patients, along with the ligament injury, they have a cartilage injury also. So to identify those cartilage injuries, or we say associated injuries along with this ankle sprain. So to identify those injuries, MRI is very much necessary, and MRI will tell us about whether the ligament is partially torn or a completely torn. And also it gives more insight into what's happening in the ankle. Are there any cartilage injuries? Are there any defect in the cartilage? Or any other ligament is torn associated with this ankle sprain?
Okay.
So then we go for a surgery, and in surgery, in the latest development is a augmentation procedure, where we repair the ligament, and to protect the repaired ligament, we put a kind of a belt. You have seen that the person who is driving a car, they put a belt across seat belt. In the same way, to protect the repaired ligament, we put a belt kind of structure, or we say augmentation procedures in the medical field. So that will protect and also it strengthen the ankle like before. And to come to your particular question, how soon they can go back to their activities, like if we are doing a repair without augmentation, they can start weight bearing by 2 weeks or 3 weeks. If we are doing this advanced technique called augmentation procedure, then everything can be started in 7 days. They can start walking, but within a special boot, they can start walking with full weight bearing. When it comes to sports activities, it is only after 6 weeks to 2 months of time they can go back to sports activities in a phased manner.
Okay.
Because we need to strengthen those ankle, because all those ankle muscles have become weak now. So after surgery, the main intention is to strengthen those muscles also. That's where rehabilitation is very important. That's where the role of sports physiotherapy that we have at SPARSH Infantry Road, they come into play, and they will start rehabilitation in a phased manner, and so that you can go back to sports activities as early as possible.
Okay. So is it anywhere like a daycare thing?
Yes, this is a daycare procedure. It is a daycare procedure where you can come in the morning, get surgery in the early noon, and you can go back to home by evening.
Okay.
So it is not something very major procedure, very minor procedure, but expertise is very much necessary. Otherwise, the ankle may not function like before.
So thank you, doctor, for being here with us today. It was really a knowledgeable session. Yeah, it has really helped everyone, including me, who might have had so many myths about the condition. Yeah, thank you so much.
Yeah.
Thank you.
Thank you.